I think it's an amazing treatment, considering there's a possibility that patients could stop taking medication or insulin. For patients whose hemoglobin A1c is as high as 9 or 10, when we performed stem cell therapy on those individuals, there were cases where their hemoglobin A1c dropped by about 2 points. Hello, I'm Dr. Wakabayashi, the Rejuvenation Doctor. Nice to meet you. So today's video topic is stem cell therapy extremely effective for diabetes? I'll be thoroughly explaining the treatment methods recommended by the Rejuvenation Doctor. Finally here, huh? So this time we're going to talk about how stem cell therapy is said to be extremely effective for diabetes. We're jumping right to the conclusion, but what are your thoughts on that? That's right, diabetes treatment, taking oral medication or insulin, this kind of treatment or treatment for complications is what we're talking about. I think it's an excellent treatment option. I'm sure there are viewers out there who are diabetic or considered pre-diabetic, and many people probably have slightly elevated blood sugar levels as well. So I'd like you to start by explaining the basic knowledge about diabetes. First of all, could you please explain what kind of disease diabetes actually is? I think most people are pretty familiar with diabetes, but basically it's a condition where your blood sugar is high. There's type 1, which tends to occur in younger people, and type 2 diabetes, which is also related to genetics, but is much more common in patients from their late 30s and older. The really tricky thing about diabetes is that symptoms don't show up right away. For example, it's not like knee pain, vision problems, or itching. Those symptoms that make you want immediate relief are less likely to appear. For diabetes patients, the hardest part is really the daily struggle with blood sugar levels and having to take medication every day. If diabetes progresses and symptoms do appear, what kind of symptoms would those be? The real issue is what happens in the end if your blood sugar and blood pressure stay high. Especially in the case of diabetes, the most well-known complications are related to the eyes. Diabetic complications affecting the eyes. For example, there's retinopathy, which can lead to blindness. And then there's the kidneys. The blood vessels in the kidneys gradually deteriorate, kidney function worsens, and this can eventually lead to dialysis. There's also what's called neuropathy, where nerve damage makes it harder to feel anything. And because blood flow gets worse, for example, you might not even notice if you get injured. If you don't notice or just leave it untreated, it can get infected and keep getting worse. As I mentioned, the three major complications, eyes, nerves, and kidneys, are the most well known. But recently, there are other issues that can also lower your quality of life. For men, there's ED, which is basically an extension of neuropathy. There have also been reports of other complications, like an increased risk of developing dementia. In reality, most patients undergoing treatment are on medication. And I think many people also choose insulin injections. So does regenerative medicine offer different effects compared to medication therapy? When it comes to regenerative medicine for diabetes, there's something called stem cell therapy. As for the effects of this, insulin, which lowers blood sugar, is secreted from the beta cells in the pancreas. I think one aspect is that it can enhance the function of these pancreatic beta cells. Also, even if insulin is being produced, insulin resistance, when insulin doesn't work well, causes blood sugar levels to rise. This also has the effect of improving resistance by repairing tissues in those areas. Basically, with medication therapy, you can control it as long as you keep taking the medicine, right? But with regenerative medicine, rather than just being able to control it by continuing treatment, it means you can actually expect fundamental improvement at the root of the problem. There have been many reports showing that insulin secretion capacity increases. So the main target is to actually improve the fundamental function of the pancreas itself. I see. So this is a treatment that aims for fundamental improvement. But I think there are probably people who don't really know what stem cells actually are. Could you tell us more about the specific effects in that area? Stem cell treatment involves taking fat from areas like your abdomen, extracting the stem cells from that fat, culturing them, and then injecting them back in. That's what stem cell treatment is. So stem cells are extracted from your own fat and then put back into your body, right? What kind of effects does putting them back in have? For example, with many medications, they're absorbed somewhere in the body, and most often excreted through the kidneys and urine. It's also common for them to be metabolized in the liver and then excreted into the digestive tract. What's interesting about stem cells is that after they're injected into a vein, they mainly accumulate in places like the lungs and spleen. And then they patrol the body, eventually reaching the tissues that are damaged. That's where they produce their therapeutic effects, which is the main benefit of stem cell therapy. That's amazing. They can go anywhere. This time, since we're talking about diabetes, it's the pancreas we're focusing on. So, in principle, does that mean stem cells can respond to any area where a signal's being emitted? That's right. You could say they're like the body's repairmen. For example, in the case of diabetes, even if complications have already developed, can we still expect the same effects? I think one of the appealing aspects of stem cell therapy is that stem cells can help control blood sugar levels. But I believe the best part is that it can be expected to help prevent complications, especially when it comes to nerve damage and the resulting wounds, which are often mentioned. When it comes to nerve damage, stem cells can help repair the nerves, and they also release growth factors, cytokines, that protect the nerves. These help with the repair process. Then there are the kidneys. The kidneys are very silent organs, and even if they're damaged, symptoms are hard to notice. What's really scary about the kidneys is that they undergo irreversible changes. And once they start to deteriorate, it's very hard for them to recover. Because they're so hard to heal, the damage tends to just keep progressing. There really aren't many treatments that can restore kidney function. In many cases, when things get worse, it ultimately leads to dialysis. Among the available options, stem cell therapy is expected to help prevent or even improve the decline in kidney function. How about retinopathy? Regarding retinopathy, since it's a localized issue in the eye, there are some challenges involved. Unfortunately, when it comes to retinopathy, there still isn't a lot of solid medical data available yet. A lot of research is still being awaited in this area. They can create blood vessels, reduce inflammation, strengthen and protect, and work in various ways like an all-rounder. So I guess that's what stem cells are, right? I think stem cells are basically like the repairmen of our cells. They release various growth factors and cytokines. These substances really show their effects, so there are a variety of benefits. In fact, I believe your clinic also offers stem cell treatments for diabetes, right? If you have any case examples, I'd love for you to share them with us. There are patients whose blood sugar control is really poor. For example, patients whose hemoglobin A1c is already at 9 or 10. In many of these cases, their medication management isn't going very well to begin with. There was a patient like that who underwent stem cell therapy and their hemoglobin A1c dropped by about 2 points. Another area is complications. There have been cases where nerve damage improved and some patients even saw their kidney function recover. When it comes to blood sugar control, there are options like insulin and oral medications, and I think there are a variety of treatment methods available. But I have high hopes for this as a treatment for complications. I think blood sugar control really depends on the patient. Even though they know they have to take their medication or continue treatment, now let's be honest, there are people who just can't manage it well in their daily lives. As doctors who aren't diabetes specialists, we tell patients to control their blood sugar. We say, please take this medicine 3 times a day. Of course, as doctors, we've instructed patients to inject insulin. But since it's something they have to do every day, patients inevitably get tired of it or fed up. That's when they start reducing the amount of medication or insulin they're taking. Or as a treatment that offers the possibility of getting off medication or insulin altogether, I think it's truly an excellent option. It can also improve daily quality of life. So even from that perspective, this treatment method is really a great one. I really do think it's a treatment that fits with modern times. Today, I talked about regenerative medicine for diabetes, especially the effects of stem cell therapy. If you're interested in stem cell therapy as a treatment for diabetes, or if you're a patient struggling with complications and are interested, please feel free to contact our clinic. If you found today's video helpful, please give us a like and subscribe to our channel. We're also looking forward to your comments and questions about this channel, so please feel free to leave a comment. Is it okay to say that the doctor will personally reply to the questions we receive? I'll be checking and responding to them myself. Thank you for watching. Please be sure to check out our next video as well.